A 22-year-old man, David, present to the emergency room with fully erect painful penis. This is what happened. David is a guy with full of hopes and ordinary dreams. He never imagined that a single night would become a battle for survival, one that would catch both himself and doctors off the guard with an unexpected tragic twist. On a humid Friday night, David arrived at the hospital emergency department clutching his pants and walking awkwardly. For the past 4 hours, he had an unrelenting erection that now throbbed with pain. The medical staff recognized the classic features of Priapism, an emergency where blood becomes trapped in penis, threatening tissue's death if not resolved quickly. Earlier that evening, David had gone on a date with Sophie, someone he had admired from afar for months. The evening sparked with laughter and nervous glances. Unknown to him as Sophie left and the excitement faded, but his erection did not even after hours. Alone and increased distress, David realized this is not ordinary situation. Hospital clinicians swiftly intervened. They performed an aspiration, draining the deoxygenated blood from his corpora cavernosa. The corpora cavernosa are the two cylindrical regions of sponge-like erectile tissue found along the length of penis, which fill with blood during sexual arousal, resulting in erection. The relief was temporary. Within half an hour, his erections returned, just as painful. Now, with threat of permanent damage, ischemic priapism is a medical emergency marked by painful, persistent erection lasting more than 4 hours without sexual stimulation caused by trapped, poorly oxygenated blood in the penis. Data shows that ischemic priapism lasts beyond 4 hours, can lead to irreversible fibrosis and erectile dysfunction in up to 50% of cases if not treated rapidly. Faced with recurrence, the doctors decided to escalate the treatment with Winder's procedure. This is a minor surgical technique where small incisions are made through the glans penis straight into the corpora cavernosa, creating a new path for the trapped blood to drain. Studies reveal success rate of about 70% for Winder shunt in resolving priapism, though complications like infections and erectile dysfunctions are possible. David's ordeal took an alarming turn. As he lay recovering, a junior doctor noticed he was struggling to lift his foot while walking to the restroom. A sudden foot drop. Alarm bells rang. Foot drop suggests neurological compromise. Alongside priapism and new-onset pelvic pain, these symptoms pointed towards a neurological problem rather than a simple blood flow disorder. A quick neurological exam revealed pelvic extension weakness too, a potential ominous sign. Urgent MRI imaging was done, which confirmed the diagnosis: spinal epidural abscess, compressing his lower spinal cord. Spinal abscesses are a collection of infected material with the epidural space, often bacterial and sometimes seen in immunocompromised or diabetic patients, but possible even after minor infections or trauma. Delays in diagnosis can be catastrophic. Spinal epidural abscess is rare, affecting about 1 to 2.8 per 10,000 hospital admissions, but incidence has risen likely due to more frequent epidural procedures, rising rates of diabetes, and IV drug use. As the abscess forms, it compresses the spinal cord, interfere with the nerves that control not just the movement but also pelvic and genital blood flow. Compressions of autonomous nerves in the sacral plexus can cause priapism. Similarly, damage to the motor nerves leads to symptoms such as foot drop, pelvic weakness, and eventually paralysis if untreated. In David's case, bacteria cultures later show Staphylococcus aureus, most common culprit that is responsible for up to 70% of spinal epidural abscesses. Patients with spinal epidural abscess may develop progressive paralysis, loss of sensation, bowel and bladder dysfunction, and even sepsis if infection spreads. Sepsis is a life-threatening condition that arises when body's response to the infection becomes dysregulated, resulting in widespread inflammation and damage to its own tissues and organs. Prognosis depends sharply on the speed of diagnosis. One study found that up to 45% of patients left untreated for more than 24 hours after motor symptoms appear to become paraplegic. Paraplegia is a condition that is characterized by paralysis that affects the lower half of the body, typically the legs and lower trunk. This paralysis results in loss of motor and sensory function below the level of spinal cord injury or neurological damage. As David's story unfolds, tension rises in the hospital. MRI images, frantic consultation, and the looming threat of irreversible neurological injury create a high-stakes scenario for everyone involved. Treatment shift to urgent surgical decompression and intravenous antibiotics. Each minute matters. Priapism is most often caused by drugs, sickle cell disease, or spinal cord injuries. Rare cases are linked to underlying infections such as epidural abscesses. Surgical emergency protocol demand MRI for any unexplained neurological deficit that is associated with priapism. Despite rapid surgery, David's recovery falters. Foot drop persists. He faces months of rehabilitation and uncertain prognosis for both neurological and sexual function. His life briefly transformed by a joyful death that changes forever, as he battles lingering effect of an unpredictable and devastating disease. David's journey shows the importance of rapid evidence-based medicine, the power of observation, and the intertwined nature of physical and neurological health. It is a stark reminder that even seemingly simple emergencies may conceal life-altering diagnoses, and that the heroic action driven by scientific insights is sometimes all that stands between hope and tragedy. Thank you so much. If you like this video, give it a thumbs up and share with all your friends. Before you leave, don't forget to subscribe and hit that bell icon so that whenever I upload interesting stories just like this one, you will as soon as get notified. See you next time. Until then, take care and stay healthy.